Hi, welcome back. Talk's going to be a little longer today. We saw the second opinion surgeon yesterday, and we found out that glioma is not gleeful. The doctor only sees about a handful of these a year, unlike breast cancer and lung cancer. There's no tried and true way to fight this particular tumor. So it was very traumatic yesterday for Rose. As you saw on her, maybe seen on her Facebook status, she had a very bad day, and she had a bad day because the glioma in her brain will cut down on her lifespan. And of course, it's very upsetting, and it's hard to take when you are such a positive person as she is. And it wasn't something that, of course, anybody wants to hear, and it was very, very, very hard. And I'm upset as well. And I just show it a lot differently than she does. But thought I'd show you, it's right here. It's that little white spot right there that's causing all the issues, or will cause even more issues than it's causing now. Right now it's just affecting her right hand. She can't really feel what's going on. She can't close her hand and use pressure on it. So try to take a biopsy on it. Of course, it could make she could lose use of her whole arm. But she's willing to do that if there's a way to fight what's going on. So we'll see how it goes in the next couple months. Her next MRI is going to be a little more in depth, a little bit longer. That little that big old tube where it's right in front of you when you're laying in there to do stuff. So you would think with all the stuff she's been going through, the best thing that she has found is do a hormone panel on yourself. Go to a naturopath and get hormones done, and you can also have a food sensitivity blood work done. Because the naturopath did save Rose's life through depression. She dropped her drugs, went on supplements and some hormones, and she came out of it, and she's been pretty good for the past 18 months or so. So I suggest you find a naturopath and get some of those tested. You never know what you might be sensitive to. I'm not saying allergic. You might be sensitive to it. It helped our middle daughter Bess a lot, and it helped Rose as well. And if you can get something out of this, you can get something out of it. So we went to an oncologist, naturopath, and he's going to prescribe some frankincense for Rose to help with the inflammation that might be causing some of the tingling in her hands and lack of pressure. So that was kind of interesting, the frankincense. Well, what we're hoping for is we can also get some myrrh and some gold out of that. That would be just a more of a much better outcome to get some of the stuff like that. So this will be the last video entry for a little while, because Rose is going off to La Crosse, Wisconsin next week to ride in the JDRF Ride for the Cure to help raise money for JDRF, which is a charity we support because our middle daughter Bess has had diabetes for 14 years. So I think this is one thing that I really said, Rose, you got to do this. You can't put your life on hold yet. You've got to do this for Bess and for yourself, to have one more thing to do, one more fun thing to not occupy your mind with the brain tumor and stuff like that. So she's going to head off and have a good time in the heat and humidity of La Crosse, and have a wonderful 4 days. So Avery and I will be here, and we'll go from there. So unless something else comes up in the next couple days, I'll talk to you in a couple weeks. Thanks.